Radio. I'm your host, Cynthia Thompson. Now, a few weeks ago, I had a Dr. Lowe here, and he talked about weight loss surgery. And we talked on, and we got so much good information from him. And I didn't have a chance to go over the 3 most common types of weight loss surgery. So he said that he would come back. And thank you for coming back so that we could talk more about that. But before we start talking about that, Dr. Lowe, why should people consider weight loss surgery?
Well, the short answer is there is no alternative.
Huh.
Now, let me explain what I mean by that.
Okay.
There was a study done in Sweden called the Swedish Obesity Study. And what they did in this study is they took 600 people who struggled with obesity, severe obesity, morbid obesity, and gave them weight loss surgery. And then they took another 600 and said, let's try to diet and exercise and diet pills and see your doctor regularly, see a nutritionist, and try all the medical therapies for your weight. And let's check back in 10 years and see how you're doing. 10 years later, as you might imagine, the people who had the surgery were still keeping off 25% of their weight. The people who had not had the surgery had gained an additional 4 pounds on average.
Because you can't stay on diet pills forever either.
Exactly. And the other thing is the people who had the surgery, more of them were alive. It increased survival in people who had had the surgery. Now, that fits with common sense. If you kind of think about people that you've known in your life who are 250 or 300 pounds, how many of them do you know who've been able to lose 100 pounds and keep it off over a 2-year period, 3-year period, 5-year period?
Nobody.
How many do you know who could lose 20 or 30 pounds in a few months? Probably a lot.
Yeah.
But how many do you know who could keep off 100 pounds or 50 pounds over a 5-year period or 10-year period? The study fits with our own personal recollection of what's all around us and what we see every day. So the reason for it is because when you need to lose 100 pounds or more, when you have to lose that kind of weight, it takes a year to lose all that weight. And most people can diet for a month, 2 months, 3 months, and be on a calorie restriction for about that long. But then after that, they'll hit a plateau. And it's usually in that plateau where people get into trouble. And they say, well, I'm starving myself and I'm exercising and I'm walking and I'm just drinking nothing but water all day long and I'm hitting a plateau and I can't break out of it. Forget this, I'm getting frustrated. Why should I starve myself and get no results? And that's usually when people go back to old eating habits and regain the weight. Never realizing that if they had stuck with it a little bit longer, all the way out to a year, they could lose the same weight as someone who's had weight loss surgery. But here's the problem. Who can starve himself or herself for a year when there's food all around you and TV commercials every minute and parties and office parties and celebrations and things that are constantly around you, tempting you, and the smells of restaurants as you drive home, tempting you. Who can starve themselves for that long a period of time to get all of that weight off? So what the surgery does is it helps you to not feel that hunger, or if you do, to not be able to put as much food in your stomach at a time, so that you can continue to be on a low-calorie diet to get the weight off.
Well, that does make a lot of sense now that you explain it. And thank you so much, and maybe my viewers will see that it does make sense to really consider weight loss surgery if you are truly obese. So what are the 3 most common types of weight loss surgeries, or the ones that you all do in your practice?
The 3 most common are the gastric band, also commonly called the lat band. There's another brand called the Realize band. There's also the sleeve gastrectomy. That's kind of the new operation, new kid on the block. And then there's the gastric bypass.
So let's go through and talk about each one of those. Let's start with the lat band. What exactly is the lat band?
The lat band is a silicone band that we wrap around the upper portion of the stomach. And the stomach is normally about the size and shape of a football. And we wrap this around the very top of the stomach to make it look kind of like an hourglass.
Okay.
What that does is it makes it so that when you eat, food goes and fills the top part of the stomach. The top part is about egg-sized shape. And all the rest of that football-shaped stomach is under the band or under the belt of the hourglass. So the food fills the top part of the stomach and slowly trickles through. What that configuration does is it tricks your brain into making you believe the whole stomach is full because the top of the stomach is full, even though you've really just eaten a small portion. The nice thing about the band is that it is adjustable and reversible. So if someone says, hey, you know, Dr. Lowe, I can really eat a whole plate of food, I feel no restriction, I feel like I don't even have this band, I can take some fluid, inject the fluid into the band, inflate cushions in the band, that tightens it up, so now the food goes through the band slower and they feel restriction again. So they eat less.
So you can make it tighter and make it looser.
Yes.
Like during Thanksgiving, you can make it looser.
No, we don't want to do that. We don't want to loosen it for cruises. We don't want to loosen it for Thanksgiving. We want to keep it like it is. We only want to loosen it if it's too tight. Meaning that nothing gets through or it's causing problems with vomiting. So if that kind of thing happens, we can loosen it a little bit, but we don't want to loosen it for those special occasions.
You know, you did an excellent job of explaining this, but I have a short video animated clip of this procedure. So let's take a few minutes to take a look at that.
Okay.
Okay. Dr. Lowe, now that I saw the video, it makes a whole lot more sense.
Yes.
You have it's like a rubber band around it, so I guess that's why they call it the band.
Correct. That's correct.
So if by chance I decided to have the lap band, how long would a surgery like this take?
We can usually do that procedure in 40 minutes. It's done laparoscopically, so you'd have it through just tiny little keyhole incisions. And it's an outpatient procedure. So,
oh, really?
Yes, you go home the very same day. Most people are back at work within a week or two after a procedure like that.
So if by chance I got the lap band, would I be on a special diet the first couple of weeks?
Yes, you would. In fact, for all of these bariatric procedures, most surgeons, and our office included, will put people on a liquid diet for 2 weeks prior to surgery. The reason is because we want the liver to shrink in preparation for the surgery. Right now, the liver is covering the stomach. It's in front of the stomach. So we want the liver to shrink by being on that liquid diet fast, because the liquid diet will help people lose weight, not only in their body, but also in their liver. The liver has a lot of fat in it, so it shrinks and that fat melts away so we can get to the stomach and work on it. So after surgery, a person who has a band would stay on that liquid diet for another 2 weeks because we want everything to heal properly without food going down and disrupting the positioning of the band.
And about how much weight would a person lose in the first year or so with the band?
Well, the band weight loss is usually between 30 to 60 pounds on average, and it offers the least weight loss out of all the different procedures. And part of the reason is because you have to come back and make sure it is adjusted precisely. It's kind of like, yeah, it's kind of like walking a tightrope. You don't want it too loose or you'll fall off. You don't want it too tight or you'll fall off. It has to be just right. And if people can't get back into the office to make their appointments to adjust the band properly, and they could go several months without it being adjusted, they won't lose any weight. Or if it's too loose for a long period of time, they won't lose any weight. And paradoxically, if it's too tight, that can keep people from losing weight also.
Really? How is that?
Because if it's too tight, people will do what's called malabsorptive eating. What that means is they'll eat something that they know will go down, which is usually something that's a high processed food or high liquid calories, like a milkshake or ice cream or chips or crackers or some kind of carb that will slip through the band easier instead of something healthy that has fiber and bulk, like a fruit or a vegetable or something like that.
You had mentioned earlier that the band could be removed. Why would a person want to remove the band?
Well, that's one of the downfalls of the band. When it first came out, it was FDA approved in 2001. It became really popular around 2007, 2008. And that was one of the selling points of the band, is that if you ever wanted to have it removed, you could have it removed and go right back to the original anatomy. But the problem is, if you take the band out, people regain all that weight back.
Oh.
Right. And the other problem is there's about a 30% chance that we will actually have to go back and remove the band.
Oh, really?
Yeah. When we first started doing this, we didn't realize that, but now the longer and longer we've been doing it, we realize that over an 8 to 10 year period, about 30% of bands have to be removed. It can need to be removed for any number of reasons. It can slip out of place or erode through the stomach or get infected. There are a number of reasons why we might have to remove a band. Someone could be dissatisfied with weight loss, or it can cause real bad reflux or heartburn. So in 70% of the people, that's never an issue, but in 30%, it is an issue, and we have to take the band out. That's one of the reasons the band is becoming less and less of an option for people. Fewer people are choosing it because of that risk. There was a recent study that was published in our literature that showed in 2008 about 25% of all weight loss surgeries were bands. But by 2012, that number decreased to 4%.
Oh, really?
Right. There are a few reasons for that. Number one, the realization that there's this 30% reoperation rate. And number two, the sleeve came on the scene.
Now, since you brought up the sleeve, let's talk about the sleeve. Is it what it sounds like?
It is. It is. Out of all the weight loss surgeries, the sleeve is the easiest for me to wrap my mind around. It's basically what you see is what you get operation. Going back to our stomach, which is about the size and shape of a football, what we do with the sleeve operation is we trim the stomach and make it the size and shape of a banana. Make it skinny.
Okay.
Okay. And then all of that extra stomach that we're not going to use anymore, we just remove and take it out completely.
All right.
So now the sleeve is giving a person a smaller stomach. So when that person goes to eat a meal, he or she can't eat as much food as they could before surgery.
And a person can live with eating less food? Well, I guess so.
Yes, absolutely.
You know, I have another clip too. Let's watch this because I'm not totally convinced yet. Okay?
Okay.
Wow, Dr. Lowe, it is a sleeve. It's a mini stomach.
Yes.
So from watching this video, my first question would be, like I asked you before, a person can actually live off a smaller stomach.
Yes.
So what do you do with the other part?
We remove it. We send it to the pathologist. They look at it. Yes. They look at it under a microscope just to make sure there was no pathology or nothing wrong with that part of the stomach. And then it's discarded after that. We don't need it anymore.
So the sleeve, you're kind of stuck with it.
With all of these surgeries, we consider them permanent options. The band is really the only truly reversible one where you can take it out and everything is just how you were born. But with all of them, we even with the bands, we put them in with the intent that we don't want to take them out because we know a person will just gain the weight right back if we take it out. So we put that in and do all these surgeries with the intent that they're permanent.
So how long have you all been doing the sleeve, or how long has it been around?
The sleeve really started becoming popular around 2008, 2009, and that's right when insurance companies started covering it. I'll take you back a little bit to give you the history of the sleeve.
Okay.
When it first started, it started out as a staged procedure, meaning that surgeons were doing a sleeve on people who were super, super, super heavy, okay? People who were 400, 500 pounds or more, okay? What they would do is they would go in and do a sleeve, get that person to lose 100 pounds or 150 or 200 pounds, and then once they had lost enough weight, go back and do the real surgery, like a gastric bypass or a duodenal switch, some other operation to go with it, okay? To their surprise, what they were learning was, hey, these people are losing enough weight, we don't have to go back and do the second operation. So they began wanting to do this surgery as the sole surgery. Well, of course, insurance companies wouldn't cover that because they felt like it was experimental. But after doing it enough times and showing the data and proving that people were losing enough weight with it, insurance companies finally came on board. And that was about 2009. So once the insurance companies started covering the surgery, they became more popular. And you can see the increase in the sleeve corresponded with the decrease in popularity of the band.
So if a person had the band, but they still wanted to have some other type of weight loss surgery, would this be a good option for them?
It depends. There are still a lot of people who have the band and it's working perfectly. So if someone has a band and it's working and they've lost 90 pounds or 100 pounds and they're exercising and eating right and the band hasn't caused any complications, there's no need to take that band out. They can continue exactly as they're doing. But if the person does have a problem where the band slips out of position or causes severe reflux, or if the band is not functioning as they had expected, or they're not getting the weight loss that they wanted, then that would be a reason to consider removing the band and then converting to a sleeve all at one operation.
You know, let's take a short break because I have some more questions for you. But you need to catch your breath too. Okay. Okay.
All right.
So, same time next week?
Well, of course. Put away a few bucks, feel like $1,000,000. For free tips to help you save, go to Feed the Pig.
Back to Better You, I'm your host, Cynthia Thompson. I'm here with Dr. Lowe, and we're talking about the sleeve for a weight loss option if by chance you want to choose a surgery route to lose weight. So about how long is the recovery time for the sleeve?
It's about 1 to 2 weeks. The recovery time for the sleeve, the bypass, and the band are all pretty much the same. About 1 to 2 weeks recovery, because they're all done laparoscopically, all 3 surgeries. All 3 surgeries are done through tiny little incisions, and the sleeve takes about 40 minutes to do, just like the band. And the liquid diet is the exact same for the sleeve and the band, and recovery time is the same. Now, for the band, we do that surgery as an outpatient, but for the sleeve, we do want people to stay in the hospital 1 night.
To make sure that they're okay.
Correct.
So let's go over the last one. That's a kind of common one that's used by a lot of people, the bypass.
Yes.
And let's watch a video first, because there's a lot going on with the bypass.
Yes.
Okay?
Okay, sure thing.
Hello, I am Carl Lowe Jr., and in this animation I'm going to review what we do during a gastric bypass surgery. We'll start out with some normal anatomy first. Whenever you eat a meal, food goes down your esophagus and into your stomach. The stomach acts like a reservoir to hold the meal, and it begins to break the food down and then pump it into the small intestine. The small intestine is responsible for absorbing all of the calories and the nutrients from the meal. The first step in a gastric bypass surgery is to make the stomach smaller. We do that by dividing the top portion of the stomach to create a tiny little pouch. Normally, the stomach can hold about 1 quart to 1.5 quarts worth of food. When we make this pouch, we make it the size of an egg, or about 2 tablespoons. That makes portion sizes much, much smaller. The next step is dividing the small intestine and bringing that piece of intestine up to the stomach pouch. This step makes it so that the small intestine can't absorb as many calories from meals. Now you'll notice that we still have the gastric remnant to deal with. We don't remove this part of the stomach. It still stays in the body. It doesn't die or shrivel up or get infected. It still has a blood supply. And it still makes secretions. Those secretions still have to have a way of emptying out of the stomach, so we make another connection between the small intestine and itself down here. This step completes our operation. Now meals will be much smaller, and fewer calories will be absorbed from the meals. Additionally, we've made a way for the gastric secretions from the stomach remnant to empty. Well, I hope you've enjoyed learning about gastric bypass surgery. Please visit our website at carolinasurgical.com to learn about more interesting surgeries. Thank you.
Dr. Lowe, that was a lot. Not only did you show us the procedure, but you gave us a little lesson also with how the body works. So with this surgery, how long does that take? That has to take a lot longer than 40 minutes.
50 minutes. 50 minutes. We've come a long way. When I first started doing these surgeries in 2004, it would take between 2 to 3 hours.
Oh, really?
Yes, and people had to stay in the hospital 2 nights. We had catheters in the bladder, we had drain tubes, and it was more involved. But over 9 years of doing this surgery, we've just gotten better and better and better at it. And now we can do it in 50 minutes, no drains, no catheters, and out of the hospital the next day.
Wow, and about how much weight would a person lose with this? Because this is pretty serious.
It is. The typical weight loss is between 90 to 120 pounds. Now, the things that determine weight loss, number one, age. Younger people tend to lose more weight because they have a higher metabolism. Gender. I know it's not fair, but men lose weight faster than women do. Can't get around that. Another factor is where the person started out. So if someone starts out at a heavier weight, they have more weight to lose, so they'll actually wind up losing more weight than someone who starts at a lower weight. So someone who starts out at, say, 400 pounds might lose 150, 170 pounds. but someone who starts out at, say, 250 pounds might lose 80 pounds. So the heavier you are to start, the more weight you'll lose with the surgery. So those are the main then the other one is how well someone sticks to the program and how much they exercise. People who are very vigorous about their exercise and don't take any days off will lose more weight than someone who won't exercise at all.
So this surgery looks like it's permanent also.
It is, yes, it is permanent. But this is a permanent problem, so we're looking for permanent solutions.
And so we've discussed 3 different types of surgeries. How does a patient decide which one is best for them?
Well, that's a good question. Part of it is getting help from the doctor, the surgeon, that they're going to see. Part of it is what are their goals and where are they starting. So if someone has diabetes, then the gastric bypass or the sleeve will do a better job of getting rid of that diabetes than the band.
Right.
So that would be in favor of those procedures. If someone has more weight to lose, say if their BMI is higher than 50 or in the 60s, which would correlate to a weight of maybe over 300 pounds, then that person might do better with a gastric bypass, something that can get more weight off of them. Let's say someone has a lower BMI and they just need to lose maybe 80 to 100 pounds. They're young and they exercise a lot and they don't have any other medical problems like diabetes or high blood pressure. They might do better with a sleeve.
I'm sure you've performed hundreds of these surgeries. Do you have a story that you'd like to share with us about one of your patients, a success story about one of them?
Yeah, oh sure, I have numerous success stories. The success stories are the whole reason why I do this surgery. I have a woman who came in, she had a sleeve surgery and she lost almost 100 pounds. And she came into my office and she said that she was running. She said she had run a 5K and had run a 10K. She had joined a club called Black Girls Run and was running regularly with them. And that she was going to do a half marathon and her eventual goal was to do a full marathon.
Wow.
And she was on her way. She said, Dr. Lowe, I never would have thought that would be me, the runner. But after getting this weight off, I just love it.
Wow.
That's what keeps me going.
Learned so much about these surgeries, and you know, I may want to give it a second thought.
Okay.
Maybe doing this, maybe, but I don't know. I'll need to do some lifestyle changes first.
That comes with it.
And I'm so glad you came on my show today because so many people have questions about weight loss surgeries and they hear sometimes the wrong information. So I'm so glad you were here to clear everything up for me today, Dr. Lowe.
Thank you.
I want to thank each and every one of you for joining me here at A Better You every Wednesday night at 6 p.m. here on Public Access 21. Thank you so much.